Speaking of evidence, our next speaker, online speaker, is Dr. Karen Mack, a research fellow at UCL in Quantitative Social Science, and her talk will be The Impacts of Arts and Cultural Engagement, Evidence from Population-Based Surveys. Karen, hello.
Hi. Thank you, Maria. Hi, everyone. My name is Karen Mack. I'm a senior research fellow at the University College London. And I'm so sorry that I can't be with you in person today, but I feel very honored that I have this opportunity to share with you the current studies about the impacts of cultural engagement on health. So what is cultural engagement? This can be ranged from loads of different activities, including visiting an opera, theatre, concert, heritage, museum, exhibition, and arts gallery. Sometimes researchers explore each activity individually, but other times they would group them together given their shared similar experiences. Now, 3 years ago, the WHO has published a report which was written by Dr. Daisy Van Court and Saoirse Sveen from University College London about the role of the arts in improving health and well-being. This report suggests that arts and cultural activities combine lots of different components that we know are beneficial to our health. For example, involvement of the imagination, sensory activation, cognitive stimulation, and social interaction. And these components can prompt psychological, physiological, social, and behavioral responses that could help prevent illnesses, manage and treat mental or physical health conditions, and promote healthy behaviors. Now, the relationships between cultural engagement and mental health are widely established in studies, but data from cohort studies, where the studies track individuals from their infancy to older adults, provide further insights. For example, we find that engaging in cultural activities are associated with greater levels of life satisfaction, particularly for people who are engaged as infrequently as yearly. We can still see a long-term impact of cultural activities across 3 years. Such engagement can also help reduce depression. Now, if we followed 100 participants who never engaged in cultural activities for 1 year, we would expect on average that 5 people being diagnosed depression during the year of observation. This is compared to 2.3 depression cases amongst those who engaged in these activities once a month or more. And when compared to people who never or infrequently engaged in cultural activities, those who engaged every few months or more had 32 to 48% lower odds of developing depression over the following 10 years. But can this relationship be explained by socioeconomic status? So in another study, researchers used a more sophisticated technique called propensity score matching to match participants based on their age, gender, and their socioeconomic status, and to test whether engaging in cultural activities continues to associate with lower incidence of depression. And results show that even if we match people on their socio-demographic backgrounds, engaging in cultural activities continue to reduce the incidence of depression. So what this is suggesting is that while socioeconomic status is an important predictor of whether or not one engages in cultural activities, it is not an overall explanation for the relationship between cultural activities and depression, and that the protective effects of such engagement can be found amongst people with various levels of wealth, educational qualifications, and occupational status. How about online museum? Does it still have an impact on our health, mental health and well-being? So in this intervention study, participants were asked to engage with one of these 2 online exhibitions from Google Arts and Culture, a Monet, Water Lilies, and Bento. Now, the study found that with just under 5-minute exposure, both paintings improved participants' negative mood, anxiety, loneliness, and well-being. And it is very interesting that there wasn't much difference in the impacts between these 2 paintings. one which is considered as art, the water lilies, whereas bento, which is considered as non-art paintings, and there's no much difference in terms of their impacts. So one reason for that could be the similar responses, such as generally positive interaction with visually pleasing material that was invoked in both conditions. While the water lilies painting was rated as more beautiful and good, both conditions were equally meaningful and invoked a desire to experience them again. And in fact, the researchers found that almost 70% of those in the bento condition actually believed that they had engaged with art. So the label of art alone may not be a necessarily important factor of cultural interventions, but rather the subjective experience that the individual has with the content is much more important. Cultural engagement may also help improve older adults' cognition and reduce their risk of dementia. For example, as part of the cohort study design, participants were invited to complete a semantic fluency test where participants were asked to think of as many words from a particular category, such as animals, as possible in under 1 minute. And this study shows that going to exhibitions such as an art gallery or museum and going to live performances such as the theatre, concert, and opera could have benefits for semantic influence, even after factoring in a range of demographic, health-related, and activity-related variables. The study also finds that there may be a dose-response relationship, meaning that the more frequent we visit these places, the greater benefits we may receive on cognition. And for dementia, it has been shown that visiting museums every few months or more was associated with lower risk of developing dementia. While part of the association could be explained by social factors such as marital status, loneliness, social network size, and social support, they only accounted for 9 to 10% of the association. So what this is suggesting is that it is not just the case that cultural engagement has protective association just by compensating for a lack of social interactions, but instead, this study suggests that cultural engagement may have additional cognitive benefits that social factors do not provide. And this has implications for social prescribing schemes, which I will talk a little bit more later for older adults, because it suggests that even amongst people who are not lonely or not isolated, encouraging cultural engagement could potentially be beneficial for reducing their risk of dementia. Cultural engagement may also help improve physical health. Older adults who engaged in these activities every few months or more had a reduced risk of becoming frail and a slower progression of frailty over time. Although in this analysis, 83% of respondents reported that they have engaged in cultural activities, only 41% do so at the level required for benefits on frailty incidence or trajectory to be felt. Cultural engagement may also promote longevity in older adults. This study followed a nationally representative sample of adults aged 50 and above in England for 14 years and used linked mortality data from National Health Service records. They found that cultural engagement could have a protective association with longevity in older adults, where the risk of dying at any point during the follow-up period amongst people who engaged every few months or more was 31% lower than those with no engagement. Now, this association could partly be explained by differences in cognition, mental health, and physical activity between those who do and do not engage in the arts and the culture. But even then, the association between cultural engagement and mortality remains when these factors were considered. So this suggests that while these three factors are important to explain why engagement can help, is associated with survival age, they do not explain, they do not the overall explanation for the association. Apart from from improvements in our health, we can also understand more about health and well-being through drawings, paintings, and exhibition objects. For example, these self-portrait paintings were painted by William Otamolan, who experienced Alzheimer's. We can see from the changes in his portraits that he might have either lost his artistic skills or experienced changes in his psychological mind. But either way, we can see how his mind slipped away from him bit by bit because of the disease. Another picture shows a protective uniform of health carers during the outbreak of Ebola. Now, because the health carers were fully covered to protect them against the virus, this made it very hard for patients to see their faces, and the design of the uniform often made patients feel uneasy. So to make them feel more calm and more relaxed, an artist redesigned the uniform by adding a picture of the health carer. So I don't know if you could see, there's the picture of the carer in front of the equipment. And afterwards, patients reported that they feel more cared and they feel more relaxed because now that they can see the face of health carers. Such exhibition allows audiences to connect with the people who experience the outbreak. It also allows the audiences to understand the emotions of the patients and the health carers. Now, one common feeling reported by participants after visiting museums, galleries, or exhibitions is the feeling of educated and inspired. And this is particularly so when visiting museums with a specific theme but have a long history. For example, the Foundling Museum in London tells the story of the Foundling Hospital, where they looked after children, where the word hospital does not mean a place that looks after the sick, but providing hospitality for children in their care. So the story resonates very strongly with looked after children under the age of 18 who are growing up in children's homes, hostels, and in foster care. And one of them, in their words, said that every brush stroke of every painting was painted for me. Now, understanding their place in history and culture had posed positive impacts on young care experienced adults, which later inspired a new project to develop training and mentorship program run by people who previously received cares to deliver workshops at the museum for children currently in children's homes, hostels, and in foster care, allowing the communication to continue and providing a safe, supportive, and inclusive environment for the looked after children. So I would like to finish my presentation by talking you through the social prescribing schemes. Now, decades of research on the health impacts of cultural engagement have inspired the development of social prescribing schemes, such as museums on prescription, where individuals can be referred to community activities from their GPs or link workers to improve their quality of life, such as learning new skills, facilitate social connections, and enhance their health and well-being. There are many activities that have been included as part of the social prescribing scheme, such as visiting museums and heritage, taking part in voluntary work, joining clubs, and engaging with green space. So why does social prescribing work? Well, because the schemes integrate psychological, social, and biomedical approaches to improving health, meaning that they could offer another alternative to pharmacological prescribing, which can be attractive to people because they're not seen as medical. The schemes also provide different types of social and community activities for people to choose from, so giving them more autonomy in controlling and improving their health and well-being in their own way. Social prescribing schemes can also help address social determinants of illness, such as the lack of social exclusion. And also, the non-medical language can decrease stigma and shame and reduce barriers to seeking help, and therefore more people may be more willing to seek support through the social prescribing pathway. Now, this map beautifully shows the countries that have either developed or implemented social prescribing programs, such as the US, UK, China, Japan, Australia, and part of Europe. So it shows that how the social prescribing is growing internationally now. So there have been some early analysis of social prescribing. Now in the UK, they found that in a place called Shropshire, that it helped reduce demand of GP appointments by 48%. It helps reduce 33% in A&E attendances and 58% unscheduled hospital admissions. Research also found that the appointments have been shortened by 60%. And over a half of the GPs felt that social prescribing reduced their workload. Now, more analysis will need to be conducted to understand the effectiveness of social prescribing schemes, and also the short-term, medium-term, and long-term impacts of the schemes on individual and social health and well-being. But the extensive research on arts and culture and health provides promising evidence that some patients can benefit from the social prescribing schemes. Thank you very much for listening to the presentation.
Thank you very much, Karen. You hear me well?
Thank you, yes, I'm well. Hope you're well too.
Do we have any questions for Karen? No hands raised. Could I quickly ask, how long is the social prescribing program on? So how long does it take for it to be incorporated into the system and the society? Maybe you said it, but I missed it.
As in, like, how long the program has been implemented in the UK, or?
Yes, implemented in the UK.
Yeah, so it actually has been implemented 20 years ago, but it didn't get a lot of attention in early days. But then later on now that we have more and more evidence on how the arts and cultural activities improve health and well-being, and the government and the National Health Service in the UK started paying more attention on this and to see whether it can help to provide an alternative way for patients.
Thank you. Any questions for Karen? We have a hand raised. Marlene, is it you? I was going to ask people to state who they are and their affiliation, so please introduce yourself. Thank you.
Good morning. My name is Marlene Mouliou. Karen, your presentation was really amazing, with a lot of interesting information to take on. Just a quick question about social prescribing. Do you monitor external factors like social historical events that may define the psychology of the population during the time of the survey? So how can you monitor the different regulations of the population psychology, depending on the time of the year or the time of generally crises that may happen during the time of the survey, and how these affect the effectiveness, the impact of the social prescription?
Thank you. So just to make sure that I understand your question, so how do we know that the patient's psychological conditions can benefit from the social prescribing schemes? Or?
No, my question was if you have a way to monitor during the time of the evaluation, of the assessment, of the participation of the of the patient in the social prescribing, if you can monitor the external factors, what is happening in society, and how does this affect the actual experience of the participant? How can you monitor this as an external criterion, as an extra parameter?
Yeah, understand. Thank you so much for your question. So there are a couple of ways that, in fact, currently the UK now department has been doing a little bit more research on social prescribing and to see the effectiveness of it. One way of doing it is to implement a social prescribing question into a national representative study, and to ask respondents whether or not they have been prescribed social prescribing schemes and how effective they are. That's one way of monitoring it. And this is usually quite a useful way, because these surveys tend to be nationally representative, meaning that they can be generalized within the population. And also we can track who are the people more likely to be prescribed the social prescribing and who are more likely to be benefits from the schemes. Another way to track and to monitor is to run a clinical randomized control trials where we send some of the patients to try the social prescribing schemes and then to see whether their conditions have been improved. I hope that I've answered your questions.
Thank you very much.
Thank you very much, Karen.
Thank you.
I think we'll have to close to continue to our next speaker, if you don't mind, because we're running out of time a bit. So thank you very much. Enjoy the rest of your day.
Thank you.
Hopefully you can listen to us online.